Tuberous sclerosis complex, or TSC, is a rare genetic disorder. It causes non-cancerous tumors to grow in different parts of the body. Imagine a tree with many branches. TSC can affect various organs, much like branches growing in different directions. This complex condition arises due to mutations in either the TSC1 or TSC2 genes, which normally regulate cell growth and division. When these genes malfunction, it can lead to the uncontrolled growth of cells, forming tumors in various organs. TSC is not contagious. It is typically present at birth, although symptoms may not be immediately apparent. The severity and range of symptoms can vary widely from person to person, even within the same family. One of the hallmarks of TSC is its impact on the skin. These skin manifestations are often the first noticeable signs of the condition. One common sign is hypomelanotic macules, commonly known as ash leaf spots. These light patches of skin are usually present at birth and may be more easily visible under ultraviolet light. Another characteristic skin finding is angiofibromas, small reddish bumps that typically appear on the face, resembling acne. These benign tumors are composed of blood vessels and connective tissue. Individuals with TSC may also develop Shagreen patches, which are thickened, rough areas of skin often found on the lower back or buttocks. The brain is another organ frequently affected by TSC. The tumors that grow in the brain can disrupt normal neurological functioning, leading to a range of symptoms. Seizures are a common neurological manifestation of TSC, affecting a significant proportion of individuals with the condition. These seizures can vary in type and severity, ranging from subtle, brief episodes to prolonged convulsions. Developmental delays are also frequently observed in individuals with TSC. These delays can impact various aspects of development, such as motor skills, language acquisition, and cognitive abilities. The extent of developmental delays can vary depending on the location and size of brain tumors, as well as the overall severity of the condition. While skin and brain manifestations are common in TSC, the disorder can also affect other vital organs, including the kidneys, heart, lungs, and eyes. These manifestations can be particularly insidious, often without causing noticeable symptoms in the early stages. This makes regular medical checkups and monitoring essential for early detection. Tumors can develop in the kidneys, which are known as angiomyolipomas. These benign tumors are composed of various tissues, including blood vessels, smooth muscle, and fat. They can also appear in the heart, lungs, and eyes, potentially leading to serious complications if left undetected and untreated. For instance, in the kidneys, these tumors can grow large, potentially causing kidney damage or bleeding. Regular monitoring and early intervention are therefore crucial. In the heart, non-cancerous tumors called cardiac rhabdomyomas can be present. These tumors are often found in infants with TSC and can sometimes interfere with heart function, requiring medical intervention. In the lungs, tumors can lead to breathing difficulties and other respiratory issues, while in the eyes they can affect vision. These tumors are a common finding in TSC, and their growth can lead to significant health issues. Therefore, it is important to have a comprehensive care plan in place involving regular checkups and appropriate medical interventions. Cardiac rhabdomyomas, non-cancerous tumors of the heart muscle, are often present at birth in infants with TSC. While these tumors typically regress on their own, they can sometimes interfere with heart function, requiring medical intervention. It is crucial for parents and caregivers to be aware of these potential issues and to work closely with healthcare providers. They can sometimes interfere with heart function, requiring medical intervention. Early detection and treatment can significantly improve outcomes for individuals with TSC. Section 5, the diagnostic journey, unraveling the mystery. Diagnosing TSC involves, a comprehensive evaluation that considers clinical findings, imaging studies, and genetic testing. This multifaceted approach ensures that no stone is left unturned in the quest to understand the patient's condition. The presence of characteristic skin lesions, such as hypomelanotic macules or angiofibromas, may raise suspicion of TSC, prompting further investigation. These skin manifestations are often the first visible signs that alert healthcare providers to the possibility of TSC. Imaging techniques like magnetic resonance imaging, or MRI, play a crucial role in detecting tumors in various organs. MRIs provide detailed images that help in identifying abnormalities in the brain, kidneys, heart, and other vital organs, which are commonly affected by TSC. An electroencephalogram, or EEG, is a test that measures electrical activity in the brain and is used to diagnose and characterize seizures. Seizures are a common symptom in individuals with TSC, and EEGs help in understanding their frequency and severity. Genetic testing is essential for confirming the diagnosis of TSC. It involves a detailed analysis of the patient's DNA to identify mutations that are indicative of the condition. It involves analyzing the TSC1 and TSC2 genes for mutations. These genes are responsible for producing proteins that regulate cell growth and differentiation, and mutations can lead to the development of tumors. Identifying the specific gene mutation can provide valuable information for prognosis, genetic counseling, and potential targeted therapies. This information is crucial for developing a personalized treatment plan that addresses the unique needs of each patient. Section 6. A multifaceted approach to treatment. Treating TSC requires a multifaceted approach that addresses the diverse range of symptoms and potential complications. The specific treatment plan is tailored to each individual's needs and may involve a combination of medications, surgery, and supportive therapies. Antiepileptic drugs are prescribed to manage seizures and improve seizure control. Surgery may be necessary to remove tumors that are causing significant symptoms or posing a risk of complications. For instance, large angiomyolipomas in the kidneys may require surgical removal to prevent kidney damage or bleeding. Early intervention and proactive management are crucial for optimizing outcomes and improving the quality of life for individuals with TSC. Section 7. Living with Tuberous Sclerosis Complex, a team effort. Living with TSC often requires ongoing medical care and support from a multidisciplinary team of healthcare professionals. This team typically includes neurologists, dermatologists, geneticists, nephrologists, cardiologists, and other specialists, depending on the specific needs of the individual. Regular monitoring and follow-up appointments are essential to assess symptom control, monitor for potential complications, and adjust treatment plans as needed. Support groups and patient advocacy organizations can provide valuable resources and emotional support for individuals with TSC and their families. These groups offer a platform for sharing experiences, connecting with others who understand the challenges of living with TSC, and staying informed about the latest research and treatment advances. Section 8. Early diagnosis. The cornerstone of effective management. Early diagnosis of TSC is paramount for improving long-term outcomes. When the condition is diagnosed early, appropriate interventions can be initiated promptly, potentially preventing or mitigating complications. Early identification of developmental delays allows for timely interventions, such as speech therapy, occupational therapy, and educational support, which can enhance developmental trajectories and improve cognitive and functional outcomes. Furthermore, early diagnosis enables families to access genetic counseling, understand the inheritance pattern of TSC, and make informed decisions about family planning. By raising awareness about TSC among healthcare professionals and the general public, we can promote early detection, timely intervention, and improved quality of life for individuals with this complex disorder. Section 9. A brighter future, hope and support for individuals with TSC. While TSC presents unique challenges, advances in medical care and ongoing research offer hope for a brighter future. The dedication of scientists and healthcare professionals is paving the way for innovative treatments and better management strategies. These efforts are crucial in improving the quality of life for those affected by TSC. With proper management and a supportive network, individuals with TSC can lead fulfilling lives. Support groups and community resources play a vital role in providing emotional and practical assistance. Families and caregivers are also essential in creating a nurturing environment that fosters resilience and hope. Researchers are continually working to develop new and more effective treatments for TSC, focusing on targeted therapies that aim to address the underlying genetic causes of the disorder. These scientific endeavors are not only about finding a cure, but also about enhancing the day-to-day lives of those living with TSC. These groundbreaking advancements hold the promise of improving symptom control, reducing tumor burden, and enhancing the overall well-being of individuals with TSC. The progress in medical research is a beacon of hope, offering tangible benefits and a better future for patients and their families. As our understanding of TSC continues to evolve, so too does our ability to provide comprehensive and compassionate care that empowers individuals with TSC to live their lives to the fullest. The journey is ongoing, but with each step forward, we move closer to a world where TSC is no longer a barrier to a happy and healthy life.